We're here in Bellingham, Washington, where it's an exciting day. Lots of people have shown up despite a driving rain to take part in the third Tea Party here in Bellingham. They're lining the guide Meridian up and down, carrying signs, holding flags, and taking part in demonstrations. We're going to spend some time talking to demonstrators and see what they have to say.
My name's Alan, and I'm here because I'm tired of an irresponsible government that doesn't listen to its people.
So it's a loss of freedom is what it is. Our property rights represent our freedom.
Absolutely.
And we lose our property rights, we lose our freedom.
Thanks, David.
Thank you.
My sign says live free or, and as a citizen you should be able to fill in the sentence on your own. One of the completions of the sentences is die, and the rest of the sentences are whatever your philosophy is, life. As far as I'm concerned, if you don't live free, you're not really living at all. And if we continue selling our future down through debt in future generations, we're really not going to have much of a nation left, and we certainly won't have any of our principles left. So I just encourage people, if you haven't attended a Tea Party yet, sometime in the future you might have a chance to stand up with a flag or a sign, and I recommend you do it when you consider what the principles are that we're giving up.
Thank you, Mark. And what are the issues that brought you out here today?
The issues that brought me out here are actually the fact that our federal government has absorbed mostly the steel industry, the banking industry, the insurance industry, the mortgage industry, the real estate market industry, and those are all areas that the free market would have self-regulated but for the federal government's interference in the first place. Because as a consequence of federal regulations, these industries were allowed to do things they never ought to have been able to do in the free market. So then, as a direct consequence, the federal government now under Obama is using those regulations that the federal government improperly passed as an excuse for subjoining the freedom of all of those industries, which means that our free market is a thing of the past.
And if you could say anything to the administration or the politicians in Washington, what would it be?
Give up, in fact, everything that you're doing in Washington, D.C. Limit yourself voluntarily to 3 terms and learn what the nation is outside the Beltway, because I don't think most of you ethically have a clue. And that especially includes Rick Larson, who voted for the Acorn. By avoiding a vote, Rick Larson essentially destroyed any credibility he had left in the 2nd Congressional District because he rolled over for his Democratic bosses, and he ought not to have done that. Notice your hand.
And now I understand you're a new American citizen.
Yes, I am. I came from Canada, and I'm proud to be now a new American.
Excellent. And what brings you out today in this rainy weather?
A lot of causes. I think that we've got a wonderful country now, and I think of myself as an American, and I want to do my part to help out.
Excellent. And what made you decide to leave Canada and come to America?
High taxation. 2 words, high taxation.
Now, some people might say you came at the wrong time.
And no, I've been living here for 15 or more years. But no, the Canadian health system is going to fall apart when the baby boomers hit it. And I'm at the beginning of the baby boomer era, and we're still healthy.
So what would you say to Americans that are, a lot of people in America say the Canada system is great, that's what we should have?
It's not. There are lineups, and people are having to cut.
So the Canadian healthcare system isn't the greatest thing in the world.
No, it's not. So don't let Michael Moore fool people.
Who's going to roll? I'm getting all wet. Oh, sorry. Gosh. Okay, so looking at your sign, millions, billions, trillions, oh my, explain that to me.
Well, it's a takeoff, of course, from The Wizard of Oz, but it's the runaway spending that's going on in our country right now. And it's ironic that the younger people aren't all up in arms, because we're here to try to protect them. It's our children and our grandchildren are going to have to pay this bill, or we see hyperinflation, etc. going on. So we're here to protest the runaway spending in Washington, D.C. And without any good thought, without getting enough input from people that maybe object to it, running us around and ramming it through, a trillion here, a trillion there, kind of thing. That's what we're here for. Try to get rid of that.
Thank you. Thank you very much.
You're welcome.
So what brought you out on this beautiful day?
Well, I just wanted to see what was going on. I've never gone to anything like this, so I just feel really proud of these people to be out here and supporting the no health care, this change of health care, because I think we have the best health care in the world. And if it needs to be changed and it is so bad, I would like to know why the people in Washington, D.C., why don't they change their health care if it is so bad?
Right, why don't they get the same health care they're suggesting the rest of us
They are
get?
not going to change their health care. They're going to keep their same health care. And I think, my husband was 30 years in the military, and we have health care through the military, and now they're threatening to take that away from the people that guarded this country, and I just think it's wrong. So that's why I'm here.
And so I'm here with some of our neighbors to the north, and they're going to tell us a little bit about Canadian health care.
No, I'm not really a neighbor to the north. I'm a U.S. citizen. I was born in Canada, and all my relatives are still there. And I know that my father here would get angioplasties and stents, where his brothers in Canada with the same medical conditions were treated with medication. And they had difficulty walking up hills. They would get the angina and the chest pains, and would have to pop a pill. But my father was just, about the same age, and it was going along just fine, because every 18 months he'd get his angioplasties. And I did have a cousin in Vancouver that fell off a ladder, hurt his back, and had to wait 6 months for his MRI. And he happened to be from Nova Scotia and wanted us to annex the Maritime provinces so he could be part of America. He'd go back to Nova Scotia. And my cousin up there told me that the Canadians in Vancouver, I think we all know that really well, come down to St. Joe's for their heart surgeries because it takes too long to get them up there.
Right.
I just don't want to see us in the same boat. And I don't want to see my grandchildren picking up the tab for all this spending that we're doing.
Excellent. Thank you. All right, so we're here with a young man, and what brought you out here today?
Well, I'm sick of the wasteful spending that's going on. I don't want socialized medicine, and I don't want socialism in general.
Questions you talk to. So tell us a little bit about your sign and what the big issues are to you.
Okay, the big issues to me is the massive spending that we're going through. I retired with Prudential. I know what the deficit's going to do and what it's going to do to inflation, what it's going to do to her life down the road. And also, I was part of the healthcare program. I've seen how government regulation destroyed the pricing in healthcare and our policy premiums.
Now, can you explain that a little bit? Because that's something I think a lot of people, talk about, but not many people can really understand it from a technical level.
Yeah. See, what happens is every time the government comes in and puts a mandate on, like free Viagra for everybody, that drives the premiums up. Also, I have a friend that was a manager in one of the big hospitals. Everybody that comes in, they get treated. Okay, now people's found out that they don't have to pay. So the people that are coming in that can't pay, then they charge it back to the insurance companies. For those that won't pay, they can't collect from them. They charge it back to the insurance companies. So all of the mandates, paying for those that won't pay and can't pay, has driven the premiums up to where we are having some real problems in this country today. We need...
Well, the crowd here at Zenith, numbered in the hundreds, lots of people coming out in a driving wind and rain, making themselves heard, showing their signs, and talking with us about a lot of issues from the federal government, healthcare, taxes, the fairness document, and of course, the property tax and property rights issues going on here in Whatcom County. And you get the sense that even though the news media doesn't cover this so much, the mainstream media, there's a lot of people, a movement's growing, and they're going to make themselves heard at the ballot box. I'm Sean O'Hare with KGMI. Thank you for watching.